there! Happy New Year from My Medicine Consulting. I'm Heidi.
I'm Irvin.
And we'd like to say, of course, Happy New Year like we did already. Today is January 3rd, and Amendment 2 officially goes into effect. Kinda. It's very confusing out there, and all of the major media are shoving out news stories all across the state with a 22-page list of physicians. And we need to clarify and straighten out some things with what is going on with this law. And hopefully we'll see a press conference coming out from Florida for Care or some of those folks, and we'll get more information. But right now, those doctors are certified for the CBD law. Amendment 2, yes, it's supposed to go into effect today, but if you read the language of the petition that you signed and the law that you voted for, it's effective today, but laws have to be written.
The legislature has 6 months to put into practice what they want the law to read. And so therefore, no one knows exactly what's going to happen. We don't know what the rules are going to be for dispensaries, for grow operations, for labs, even for patients. Again, as far as doctors giving out recommendations. There may or may not be continuing education for a doctor to have to do to be able to give out recommendations for full plant material, which is what this law is about. And so right now, for any patient that really wants to go see a doctor to get a recommendation, the only recommendation that doctor can give you is for CBD.
Unless you have a terminal condition or something that qualifies under the CBD law for full spectrum plant material.
And then a doctor has to certify that you have less than 1 year to live, which you're not going to find too many doctors that would be willing to put their name on a letter saying, oh, you've got less than a year to live.
Right.
So that really is kind of a waste of time for people. And we know people that are dying, and it's sad because patients are out of time, they're dying, they don't have any time left, and they die. So we want this law to go into effect as soon as possible. However, understand that they've got 6 months from January 3rd, from today, to write a policy, write the rules. Mm-hmm. And who knows if the legislature is going to go through with it, if somehow there'll be court challenges. We don't know what's going to happen. But we here at My Medicine Consulting, we've been dealing with this since 1972. I mean, with the federal government, with different state laws. And so we feel like that we've got an upper hand as far as knowing what's best for the state of Florida, and also for local communities, which is what we're trying to do, is make sure local communities understand that the benefits of having a business, a cannabis business in their area, and that we want to make sure that it works with law enforcement, with the whole city council, with the commission, and we understand the rules nationwide as far as federal. And plus, we don't know what Trump's going to do or his people. So we feel like here at My Medicine that medical use of cannabis is going to happen in the state of Florida, and it's going to happen nationwide. As far as regulate Florida for 18 or full legalization, now with Trump in office, we don't know what's going to happen with that. So let's just work on what we have, and that's this, that the state has legally 6 months to decide how they want the law to read. So we're going to be on top of it, and we're going to be able to give consulting to people that are interested. And also keep in mind that with us here at My Medicine Consulting, when they do have a policy about how you're going to apply for a dispensary or for a grow operation or for a lab.
Or to even be a patient.
Is to understand also, and to be a patient, is to understand also that any application is going to look even better when they list My Medicine Consulting as consulting for that company. Because I'm the federal patient. I've been getting this medicine from the federal government for 34 years. I know what's best for the patient, and that's what's important. This is about compassion. This is about helping the patient. This isn't about making money. Although money will be made. Lots of money will be made in the state. We want to make sure it's done the right way. So we at My Medicine hopefully will be out there to consult, to help, and to get the best law implemented so everyone benefits from it, and especially the patients.
So in the meantime, please stay tuned to our website, mymedicineconsulting.com, as well as Florida Patients and Families United. Mymedicineconsulting.com is geared towards the business end and business aspect of cannabis in Florida. Florida Patients and Families United is for Florida patients and the families of those patients for supportive services. So stay tuned to both of those. Please be rejoicing and talk about the law. Be sure everybody knows what's going on. Have your voice be heard and be active. The worst thing you can do now is to not do anything. You need to communicate with the people around you, everywhere from your regular physician all the way up to your political bodies. And we're here to help you with that. So stay tuned and definitely sign up to our YouTube channel and follow us on everything, and we'll guide you in the right direction. That's exactly what we want to do, and keep everybody safe, happy, and healthy. So, Happy New Year from My Medicine Consulting. We'll see you again soon.
Happy New Year.